The two American agencies that regulate and fund drug testing are urging a new focus on the gaps in research. More than 40% of American adults are considered obese, yet many of the medications that people are taking are rarely tested on bigger bodies. Many widely prescribed drugs and over the counter medications work differently in people who struggle with obesity. But exactly how and at what dose often isn't clear. Now, US regulators are encouraging researchers to consider the impact of excluding obese people in their studies. Joining us now to unpack the issue is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, thank you very much for joining us again on Forum Daily.
Great to be here.
So we know that this is a report from the US, but is it safe to assume that we have the same issue in Canada regarding obesity and drug research?
Yes, while this report is quite specific to the United States, it's very reasonable to assume that we have similar, if not the same challenges in Canada concerning obesity and drug research. In 2022, 30% of Canadian adults were obese, while another 35% were overweight. So similar statistics. Both countries also share similarities in healthcare practices and research methodologies, and certainly with regulatory frameworks as well. So it's essential for us to also consider and look at the challenges here and look for gaps in drug research for individuals with obesity.
And why is it that drug trials often exclude those who are struggling with obesity?
There's a lot of different reasons. It's quite a complex issue. Participants in clinical trials, or those who are willing to participate, are often leaner. They don't really represent the diversity of the general population. Researchers also worry a lot about the comorbidities with obesity, like diabetes or heart disease, and they worry that that could cause issues with their drug trial. And also we look at other issues that could be present. So looking at drugs specifically, some drugs can become more concentrated in fat tissues and not in the bloodstream, which means there may be less medication in the blood, leading to undertreatment. And some drugs are the reverse. They stay longer in the body, and that could result in harmful interactions as well. And so because of this unpredictable nature, it's very difficult to have a homogeneous population that's representative of everyone in the group.
Can you give us some examples of what you just described, medications that may impact a person differently depending on their weight?
Absolutely. There's an antipsychotic drug called Rexulti. We prescribe it often for people with schizophrenia or major depressive disorder. Now, research has shown that in obese patients, it takes much longer to reach that concentration of Rexulti to be effective. So if we don't have that concentration, many patients and their doctors may just stop treatment too early or conclude that the drug doesn't work at all. We have other examples as well. Contraceptive medications like Plan B. Studies suggest that the Plan B for obese people may have a greater drug failure and pregnancy issues as well. And even super common drugs like ibuprofen, sold as Advil, may not relieve pain in people with higher weights when taken as directed.
And in your view, would it be more accurate to conduct drug trials on groups that are more representative of the population at large?
Absolutely. I think striving for more representative study populations is really crucial to get an assessment of medication safety and efficacy. If we exclude patients, let's say with obesity or other issues, what we're doing is we're neglecting a significant portion of the population. And then it really calls to question the validity of many of these drug trials and what it could be in terms of an applicability to our general population.
And there would also be, I assume, some equity issues there as well.
Absolutely.
In terms of the effectiveness of drugs working for one subset of the population and maybe not to the same level with another. We know a lot of medical research comes from the US. How will incorporating those who struggle with obesity into drug trials better medical outcomes in the future?
Well, I think incorporating people with obesity into drug trials is really a step forward towards what we were talking about, which is having a more general population validity. So especially with countries like the United States and Canada, a lot of the work that we do in medicine does lead to strong medical research as well, and vice versa. So having these diversity of populations is really very helpful to get a comprehensive understanding on how these medications work, who they work for, and at what doses they are needed for them to work.
Well, Dr. Raut, I really appreciate you breaking this issue down with us, and thank you for coming back on the show.
Thanks so much for having me.